Prescription drug abuse is Oklahoma's fastest growing drug problem. Of the nearly 3,200 unintentional poisoning deaths in Oklahoma from 2007 to 2011, 81% involved at least one prescription drug. In 2010, Oklahoma had the fourth highest unintentional poisoning death rate in the nation. Originally, heroin, cocaine, and methamphetamines were most commonly associated with unintentional poisoning deaths, but in the late 1990s, the most common cause of overdose deaths became prescription drugs. The Department of Mental Health and Substance Abuse Services provides this educational program to help prescribers of controlled substances in Oklahoma. In response to the Oklahoma State Plan titled Reducing Prescription Drug Abuse in Oklahoma, a work group consisting of healthcare practitioners and professionals participated in a commitment to action for provider-prescriber education. They've discovered some receive little training on the importance of appropriate prescribing and dispensing of opioids to prevent adverse effects, diversion, and addiction. Outside of specialty addiction treatment programs, some healthcare providers have received minimal training to recognize substance abuse in their patients. As a result, this online training is being developed. The material for the training is licensed through the Utah Medical Association Foundation, which is REMS approved. Additional information relevant to Oklahoma requirements for prescribing have been added by qualified members of the Prescription Drug Planning Work Group. The course will provide both national and Oklahoma data. For example, this demonstrates the number of deaths in the U.S. by drug type. Note the increase of prescription opioids over the past 10 years. Prescription painkillers, opioids, are now the most common class of drug involved in overdose deaths in Oklahoma and involve common prescription drugs such as hydrocodone, oxycodone, and alprazolam. In Oklahoma, more overdose deaths involved hydrocodone than methamphetamines, heroin, and cocaine combined. This graph shows the most common prescription drugs by year of death, unintentional poisoning in Oklahoma. This course will describe the scope and misuse and abuse problem, know the general and product-specific drug information, assess patients for pain treatment, safely initiate therapy, modify dose, and discontinue use of controlled substances, manage ongoing therapy with controlled substance, and counsel patients and caregivers about safe use, proper storage, and disposal. The course is a series containing 6 modules developed to provide healthcare providers with recommendations and resources for prescribing controlled substances safely and effectively. In the course's 6 modules, there will be case studies, interviews, test questions, graphics, timelines, and it'll include interactive components and videos. Module 1 consists of a focus on national data, Oklahoma data, and prescriber awareness and responsibility. Module 2's focus is on pain and includes types of pain, location, source, duration, and adverse effects. Module 3 focuses on pharmacology and learning about types of opioids and breakthrough medications. Module 4 is on treating pain with less risk. Module 5 is on patient and caregiver education. The last module consists of measures to protect your practice. The online course will contain realistic case studies where the learner will choose options and receive feedback. Assessment questions are included. And another interactive feature in the course will be videos or quotes from key stakeholders expressing the benefits of education. At any time, the learner may click on the Resources tab and access the full transcript of the course as well as any related resources. The timeline for the course consists of completing the entire course, including all revisions, by November 2015. Phase 1 of the pilot involves members of the work group taking the course, module by module, and providing feedback. Phase 2 of the pilot involves offering this course free to boards and any others. This is our main beta testing of the educational product and will provide the majority of our feedback. As you